So as you can see, this was exactly the topic of our research. The aim this time was to evaluate the frequency of adverse events from SARS-CoV-2 vaccination in patients with known podocytopathy, whether minimal chain disease or focal segmental glomerulosclerosis, to record the most common adverse events in this group of patients, the incidence of relapse post-vaccination, and the potential difference in relapse rate on the basis of histological diagnosis. As they already told you, it was a multi-center retrospective study. We had done 10 different centers that contributed data. We tried to identify patients that had biopsy-proven podocytopathy, whether MCD or FSGS, that had been vaccinated with at least one dose of any type of vaccine against SARS-CoV-2, and/or had an infection from SARS-CoV-2 itself that was verified via PCR test. We did exclude, once again, patients that had developed the ESKD prior to their vaccination or prior to their infection, and patients that received their first podocytopathy diagnosis post-vaccination. We record the baseline demographic characteristics of our sample, the histological diagnosis, the potential administration of immunosuppressive therapy, either as induction therapy or maintenance therapy, the outcome of the podocytopathy, details regarding vaccination status, the adverse events post-vaccination, and the potential effect of the vaccine on the clinical course of the podocytopathy. So here the definitions are slightly different than in the case of IgA nephropathy. So in podocytopathy, we're talking about a complete remission when we have a reduction of proteinuria to levels below 300 milligrams per day, a stable value of serum creatinine, and serum albumin above 3.5 grams per deciliter. A relapse, on the other hand, is regarded as a proteinuria above 3.5 grams per day after complete remission has been achieved. So 46 years of age was the mean age at diagnosis, and as you can see, our sample was quite balanced in terms of gender, 50% were of male gender, and in terms of histopathological diagnosis. As you can see, 53% were diagnosed with FSGS, and the remaining 46% were diagnosed with MCD. The majority of our patients had received induction therapy, mainly glucocorticoids, and out of these, 80% had achieved a complete remission. Regarding the vaccination, we had very good vaccination rates here too. 87% were vaccinated, almost again fully vaccinated. As you can see, the mean number of doses received was 2.9, almost 3. And 37% were receiving some kind of immunosuppressive therapy at the time of vaccination. That could be glucocorticoids, calcineurin inhibitors, or a combination of them both. Regarding the post-vaccination adverse events that were reported, 1 out of 4 patients reported at least one systematic side effect, mainly headaches, myalgias, and fever, nothing very serious. And 1 out of 3 patients reported at least one local side effect, pain and pruritus, once again. They were the most common. What we found interesting was when we were investigating the disease relapses after vaccination, we found 7 patients that had a relapse, and 5 out of them were diagnosed with minimal chain disease. However, when we further investigated these findings, we did not find a statistically significant result. That could be due to our small sample size, so it would require further research to establish a more significant result. So, as a conclusion, the vaccines against SARS-CoV-2 had a very good safety profile in our cohort, and 10% of the patients had a relapse post-vaccination. However, this did not seem to be statistically significant, at least in our sample.